I'm a travel nurse.
How much do you make?
Yearly, like $123,000.
Did you leave a previous job to get into travel nursing?
Yeah, I used to work at Everett, Washington.
How was your salary there?
It wasn't great, honestly. It was like maybe $30 an hour when I first started out. Yeah.
Are you happy you did the switch?
Oh, for sure.
Do you have any recommendations for others?
Just do it, honestly. A lot of people like debate about it and they're like trying to figure out the logistics because you have to have like 2 apartments and whatnot, but just honestly, just do it. It's awesome.
How often do you travel?
A contract's like 3 months, so every 3 months I get to go somewhere new.
I'm a nurse anesthetist.
How much do you make?
Last year I made $280.
How long have you been doing it?
2 years.
What educational background do you need to get into this?
You have to be an RN first. So I went to nursing school and then I had to work in the ICU for at least a year.
Nice.
I worked there probably like 7 and then I went to anesthesia school.
Nice. And do you like what you do overall?
Yeah, I love it. Best decision ever.
Awesome. What are the pros and cons?
The pros is the money
Yeah.
and the hours. The cons is a lot of responsibility.
Right. And how many hours a week are you working?
A lot. Anywhere from like 36 to 48.
Thank you so much for sharing. I appreciate it.
I'm a travel nurse.
How much do you make?
I would say roughly around $90,000 to $100,000 a year. I think all nurses should get raises, no matter if you're staff or if you're travel nurses.
How often do you travel?
Every 13 weeks typically, but we like to stay a little bit longer at certain locations. So we've been here since July.
How long have you been doing it total?
5 years.
What's your best advice for others who might want to get into nursing?
I would say go for it. It's a great profession. It's super beneficial, and I think that you can make a difference.
I am a registered nurse in Florida.
How long have you been doing it?
2.5 years.
How did you get into it? Did you get a degree in nursing?
Yes, so I have my bachelor's degree in nursing.
How much do you make?
I make $80,000 a year.
Do you feel fairly compensated?
Definitely not, because nursing is a very mentally and physically strenuous job, and it requires a lot of compassion and patience, not only with patients but also with working with doctors. So I definitely feel like we deserve more compensation for all of the hard work that we put in.
What are some of the pros and cons of your job?
The pros, well, I work in a hospital, so we work 3 12-hour shifts a week, so you are able to get a good amount of time off if you want to. There's also a lot of opportunities for you to work overtime as well, because there's always such a need in nursing, so you can honestly make as much as you want to make, because there is always an opportunity, at least where I live, to make as much money as you want, because there's always people that are needed on extra days. The cons, I would say, is the mental and physical stress on your body, on like your mental state. You are like so involved with a human life, so it's kind of hard sometimes to separate yourself from like patients and their families and what they have going on.
We've talked to a couple travel nurses, and we've seen that there's a little bit of a debate between like becoming a travel nurse, staying in the hospital setting. Do you have any commentary on that you could share from a nurse in a hospital setting?
I definitely see the pros of travel nursing depending on like a person's lifestyle. If you're okay with being in a different environment every couple of weeks because they're usually on a contract. But for me, I like the stability of always knowing where I am, knowing my coworkers, knowing the providers. I just feel like it makes me more able to perform my job better.
Great commentary, thank you. What career advice would you share with others who are interested in becoming a nurse, or what have you learned in general?
It's definitely something that I feel like is passion driven, so I feel like if you're going into it, I feel like passion is the number one thing. You have to care for people, and they're putting yourself last before you put like your patients always first. Your career goals and like your success always comes after your patient.
I'm a registered nurse.
Also a registered nurse.
Do you mind sharing how much y'all make in your roles?
$110K.
Yeah, I'd say like anywhere from 90 to 100.
Y'all feel well compensated for your work?
It's not about the money to us, but I just feel like working through COVID and everything that we've had to go through as nurses, I feel like for the efforts that we put forth, we could be compensated for more.
I'm different. I worked from home. I'm in clinical informatics now. I got my master's in nursing and informatics. My experience with COVID is different because I ended up working from home for 2.5 years, but I was still going out in the field and still doing the same. But definitely I feel like obviously just because with the cost of living in California, I feel like we're not compensated enough.
How long have y'all been doing this?
About 6-7 years now.
Same.
What are the pros and cons of your roles?
I would definitely say pros are just really connecting with the human soul and feeling like you do make a difference. There's not a day that I go home where I feel like I didn't like impact someone's life positively. Cons, well, yeah, definitely compensation. There's also like nurse brutality. I feel like a lot of people don't see nurses getting abused at work as a issue, but we're still human, and I feel like we should be treated the same.
Pros for me would be fairly different since she works more with patient care. Mine is more helping the providers and clinical staff, so it's definitely different to see that end of the spectrum. So I think it's rewarding knowing that the providers and clinical staff need you instead of vice versa. And for cons, I would say I'm not a licensed psychologist. I do hear a lot of complaining and it gets overwhelming. That would be the con.
What skills do you feel like y'all needed to get into it, and what skills have you learned that has helped you in your career?
Definitely interpersonal skills. I feel like a part of me is I'm a little bit not only extroverted but a little bit introverted, so I feel like if anything it's brought me more comfortable into speaking and patience and multitasking.
Being open-minded for sure, and honestly it's all about customer service. I wasn't always a nurse. I started in the food service industry. I'm still in hospitality, and it's really all about learning about different culture and being open-minded. You never know who you're going to run into. You never know who you're going to meet.
What career advice do you have for any students that might be graduating, entering the working world, or what would you share in general that you've learned from your experience?
Definitely network as much as possible. Like she said, like you really don't know who you're talking to. They could be, the head of a very big hospital that you're trying to get into. So just treat everyone the same and treat every clinical experience as a job interview. Just always be ready and stay ready.
For me, I would say work hard and find something that you're passionate in doing, because otherwise it won't feel like work at all. Do what you love.
I'm a nurse practitioner.
How long have you been doing it?
I've been a nurse practitioner for 8 years, and before that I was a labor and delivery nurse for 6 years.
How did you get into it? Like, what educational background do you have?
Yeah, I started off like the traditional route. So I did the 4-year Bachelor of Science in nursing, and then I became a nurse, and then I went back to school for my nurse practitioner for the master's.
So total, is that like 6 years or 5 years?
It was 7 for me. Because I worked full-time while going to school part-time for my master's, but it can be 6 years.
How was that experience for you?
I think I shaved a couple years off my life. It was a little stressful, but no, I loved it. And nursing is such a tight-knit community, so I have my nursing friends that I'm still cool with, so yeah.
How much do you make?
Well, it varies. So my base salary is $144.
Okay.
And then with bonuses, I can make, so like last year I made over $200,000.
Wow.
The year before that was more like $180.
Yeah.
So usually bonuses can be anywhere from $20,000 to $100,000.
Do you have any like advice or anything you would share for someone who wants to be in your position?
Yeah, if you're a nurse and you're thinking about becoming a nurse practitioner, I would probably recommend shadowing a nurse practitioner, doing a couple shadow days just to see if it's for you, because there's just so many opportunities in nursing. Like you can be an inventor, a writer, you can do research, you can be a school nurse, a flight nurse, a travel nurse. There's so many options. Leadership, management, business. So, a lot of people think being a nurse practitioner is the only route, but there's so many options. So I would say shadow a nurse practitioner and see if it's for you.
What worked for you? Anything, like any success stories, something that worked that you'd like to share?
Yeah, I would say certainly negotiating my salary. Sounds corny and cheesy, but you really won't get it unless you ask. So I just encourage nurse practitioners to ask and keep asking and negotiate your salary, your compensation package, and make sure that you make it your dream job. Things that you need to make your work-life balance better and for you to actually enjoy your job.
What are the pros and cons of your job?
Pros, it sounds corny, but we really do help people. I'm in healthcare and I really did do it to make a difference. So we help people. Pros, we get paid well. Good work-life balance. Yeah, you can make your schedule. And then again, there's just so many options of what you can do. I work in women's health, but you can do anything.
How many hours a week are you working?
I probably put in around 40-ish hours a week, but I do a lot of them from home. So I do telehealth, I can chart at home, and I do see patients in the office a few days a week. If you're wondering, come follow me and I'll help you out.
I'm an ICU nurse.
How much do you make?
I make like $42 an hour.
How did you get into this? Like, how long have you been doing it?
I have been doing it for 18 years, and I just happened to land on that path in life.
What did you study in school, or how did you get it?
Well, I was doing pre-med first. I wanted to be a trauma surgeon and realized I didn't really like school. So I wanted to abbreviate that and went into nursing school instead.
Do you like it so far?
Yeah, it has its ups and downs.
What are the pros and cons?
Pros. I can make my own destiny. I can go on any path I want to. There's a lot of open doors in nursing, and you can excel and go either in management or CRNA or anything like that. Cons, it's mentally exhausting. It's physically exhausting. It's hard on the body. It's hard on the mind. The emotional level of things, it's hard.
How's your work-life balance?
It's good. It's very good. I work 12-hour shifts. I can do 3 or 4 shifts, and then the rest is mine.
What advice would you share with anyone interested in becoming a nurse, or just in general what you've learned?
Always choose self. Put yourself first before everything else, and you have the ability to say no.
What do you do?
I'm an outpatient cardiology nurse.
How much do you make?
I make $52 an hour. I work in Salem, Oregon.
Do you like what you do?
Most days I do.
Best and worst parts?
Best part, I think getting to connect with patients and help them problem solve and provide some education for what they have going on. I think worst part is some of the structural barriers that prevent us from doing our job and connecting with people. A lot of that is staffing and just the way healthcare as a whole is structured right now.
Is there anything that you think would solve this problem? Like, I've heard staffing is such a big issue, especially like post-pandemic. What do you think would help?
I think that it's going to be really hard to address that without addressing our healthcare system as a whole and getting rid of this fee-for-service model that we have.
I'm a nurse, an RPN.
How long have you been doing this?
Not long at all. It's my first job here.
How much do you make in your role?
About $30.
Do you feel well compensated?
I believe that all nurses should be making more than they are. Pretty much 12 hours a day we're on our feet. Just feel like we deserve a bit more for all that we do.
What are the best and worst parts of your job? What do you like the most?
Helping people feel better in terms of being where they are, just making them feel a little bit better about being in the hospital and being in the position they're in. And the worst part, the pay and sometimes the hours. They can really get you.
How many hours do you work a week?
1 week about 60 hours and then the other week about like 40 hours. Definitely prioritize your health, mental health, physical health, and sleep.
If you enjoy working with and taking care of people, a career in nursing might be a great fit for you. To become a nurse, the first thing you want to do is choose a nursing career path. There are tons of different positions you can choose from, like public health nurses, nurse practitioners, emergency room nurses, and many more. The next thing you want to work on is your education. You'll need to get a degree, and sometimes you'll also need an additional license. To learn more about how to become a nurse and to explore different positions in nursing, visit the link in our bio.